Hi, I'm sitting here with Dr. Irfan. Dr. Irfan is the veterinary director at Advanced Scientific Group. This is one of the most innovative, largest camel breeding facilities in the world. They're doing over 1,200 embryo transfers a year here. It's an amazing place. We came here to see if we could help with specific conditions with the camels where the conventional treatments are not getting the job done. It's been a great pleasure working with you, Dr. Irfan, and introducing you to our ACTIVet Pro laser. You had a wonderful situation here with a very valuable sire and a kind of wound that you've called the impossible wound. So if you could, let's just talk about your experience with a laser and see if it's been of a help and a benefit for your camels here at your veterinary Advanced Scientific Group.
Thank you very much. First of all, I am thankful to you because this kind of wounds are very bad and really we are scared of treating them. And you provided us this instrument, ACTIVet Pro. This was a camel when if there is any injury or any wound in the sternum, since they are sitting and they will sit there, this sternum portion, it will touch always the ground. And they are in the sand always, sand or rough areas. And always there is irritation, contamination, and it's very difficult to go for this dressing and lot of dressing and antibiotics and then cover this area every day. It's not possible always. So when we came to me, we had one camel, it was a male donor and very, very expensive camel. And here you can see this area. You can focus, if you like, you can focus here, or I can just make it bigger. This is the wound, and this is the whole sternum area. It's flat because it will rest on the ground. And there was deep, it is very deep, it looks here, it was deep. That is why I use additional probe in this long probe. So it goes deep, it was almost ½ inch down deep. And you can see this red and contaminated. And you can see this greenish area we used to, and this whitish area, we used to do a lot of antibiotic powder, antiseptic, this sprays, topical sprays every day. And it is chronic case. So we use your ActiPro without any other thing. 11th June we started this with first we use for around 1 month below mode. Below mode, you told me it is for infection, to kill the bacteria.
That's right.
Since it is contaminated and pus was also there, it is cleaned one. It was some pus and exudate also. 1 month we use only that one, below mode. After 1 month, then you advised me that we should go for this 1 to 250 hertz for 3 to 5 minutes. We choose 5 minutes because it is, we were knowing it's very serious and very important for us. So we start from 11th June to 11th July, around 11th middle of the July, this one below mode. After that, 11th July to August, and today is 23rd September. We choose the 1 to 250 hertz for 5 minutes, and this is the result. This is the area. You can compare if you see these two in comparison. This area, this one, as this one. And the interesting thing is, I did not use any other thing. No antibiotic, no antiseptic, no dressing, nothing. Just I used to come spray some distilled water, or sometimes normal saline, even distilled water, simple distilled water. Just make it dry. With that, I have one towel also. This make it dry, and then put this. Initially, I used this probe because it was deep, so I used this one. It used to go here and cover it with the same cloth, like this one. And then after that, once it start healing, it come to the top. I used to fix this accessory, so it can cover it like this. And really, we are happy with this combination. I can send you all the video details, photo details. If you want to see, I can show you some more photographs. This is which I take from time to time. You can see 11th, this is 11th June, okay? You can see 11th June. This is 11th June,
right?
Okay. Now, if we go back from 11th June, these are 3 pictures of 11th June. Then there is 17th June. We saw something improvement. You can see here. Infection is going now reddish, pinkish. You can see the pinkish.
So you're seeing a change.
Yeah, things have changed. Then we saw this is June, 20th June. You can see. It's a localizing. I see pit. Here you can see this pit,
Right.
deep pit.
Right.
It is now coming up. Okay.
Starting to fill in.
Yeah, filling on this one. And then it is 20th June, 25th June, 30th June if we go. You see one of the pictures, 30th June.
Mm-hmm.
Okay. And then there is 6th July. This is 6th July one. But pit is slightly there. From here then we started that flat disc. And then if we go down August, this is the August. This is the place where I send you this picture. So this is almost scar, but we didn't stop here because I don't want to take a chance that there's a recurrence. So we go again deep. It is 14th August. Today is 23rd September. This is today's picture. You can see.
That's great.
Today I want to stop it
Sure.
because it's very difficult since it is we have to give this in standing position of the camel.
Right.
And the person, I have to go under the camel because it's standing. If it is sitting, he is sitting, we can't give it. We have to then give him anesthesia or sedation, put him on the side and tie him. It's very difficult.
Sure.
To avoid all, it was initially very risky to go under the camel and remain like this for 3 to 5 minutes.
Right.
5 minutes, we choose 5 minutes. It's very good.
And were there any problems with this camel responding to the laser, tolerating it? Was there any?
No pain, nothing. I used in my finger also.
Mm-hmm. Yeah.
I had this finger here. It was, I don't know. All of a sudden, half of this nail was detached from here and down, and there was around 1 millimeter gap.
Yeah.
I go to the hospital also, and they told me, they give me some ointment. They say maybe some fungal infection or something. I was really scared because under the nail it was slight white spot, and it's not a good indication. Then the same time I used, but for this it was painful. I used 1000 hertz for 5 minutes initially. Yeah, twice a week for 1 week. After now see it's complete almost. You can see this finger. I use almost complete. And if you want, maybe I have here also one photograph of my finger. I will show you one photograph of my finger. Human finger. This is. You can see what is the condition. Huh?
Right.
Really very bad. See,
Yep.
now you see this one and you see her. It was detached from here. It is it is after maybe 1 week treatment. It was detached. This half cut was here. It detached from here. And then when I used the healing started from here and go down, down, down. Today, now it is completely okay. If you can focus this on white, white background, you can see this finger.
So what we did with the laser was we stimulated blood flow and more ATP production to stimulate this healing. If you had not used laser on this camel, how serious can these wounds be? Does this wound present a real threat to your
Frankly
side?
speaking, they don't heal up. It would have gone worse day by day. And we have many cases like this and they don't respond. Conventional treatment, they don't respond. We have to go for treatment. Even in one camel, it will end, they will increase. Sometimes there is extra growth and it becomes tumorous-like. And we have to go for surgery, we have to cut it. But again, there is a recurrence. And the most important problem in male camels is mounting. They cannot mount the female because when it is painful, when it is increasing, they can't mount. The mounting is the problem. So that is why this is one of the few worst cases, type of cases, problems I see in the male camels. I don't want this.
Of course.
Then second is the feet, under the feet, the sole. There is, they call it in local language as shafa. These are things which don't respond immediately. It is time consuming and really practically very difficult. We are a breeding center here and we need them to work for breeding every time. Now what is the principle that is scientific, how it works for us as clinicians? We want give us something that we cure our camels. How it works, it hardly
experience is better.
For treatment, we don't mind. There should not be any side effect.
Right.
And this camel is fine, fantastic, and there is no rejection or any problem, and that is why he allow us to go under the under the body and between his 4 legs to remain for 5 minutes. So it was.
And for reference purposes, how many young have been produced from this particular sire?
From this particular side. Maybe because at least I can't exactly know the total.
But you have a very good
he is one of the 4 best sires we have in the center, and we have produced, our centers already produced 10,000 plus live births, more than 10,000, more than 10,000 births, more than 10,000.
So we've established a case now with a wound that you're pretty satisfied with the outcomes of that wound.
Yeah, we are ready. That is why I told you also before this. We have one camel, one more sire, and if he is number 3 or number 4, he is number 1. And he was having some lameness, and we tried to treat with non-steroid anti-inflammatory and other things. It didn't respond. Here is one local practice that they give firing. They use the burning also. It was done, but it didn't respond. Now it is more than 5-6 months. Now I want to use this on that.
Now we have our next good case. But this time, a ligament, something that's not responsive. It's a lameness issue. And
This lameness with this, you can say those scars of this, and which are not here. Now we have leave the original problem is there. The firing place where they have put the hot iron rods, they become wounds that we are treating, and that now have slightly healed. Scars are still there. So I want to use that because it's very important. I show you this video of his movement, his leg. It is hind legs. So after a couple of months, I will show you how the improvement is in that also.
So our logic is very simple. We want to show a technology that will eliminate the need to create a wound to treat an injury, right? The burning will create another wound on top of the injury. If we can treat the injury itself with a laser without the necessity of using a burn, we may be able to give you a much faster outcome and a very good outcome, because this has been our experience with horses, thousands of different horses with lesions, especially your proximal suspensory ligaments. But we want to show you that this laser is incredibly good as a pre-race conditioning tool as well. So wounds, then ligaments. But we really appreciate you for your time and your effort, and especially your expertise and your dedication.
Thank you. You have helped us. I can say you have helped us.
Well, we're happy to do that.
You helped me to solve this issue because it isn't easy. It isn't easy. This is the latest today. Because I'm really happy with this. It's 23rd September, and we can see this scar is almost complete now.
Yeah, that's beautiful. So here's another good success story with the ACTIVet Pro Laser by Multi-Radiance. Working with Dr. Irfan, we're delighted. Thank you for the privilege of working with you here at Advanced Scientific Group. And now I've got our next case coming into view right now. So we're delighted to keep this relationship going and eventually to produce a study with you and have that study published. With your help, we'd love to make that happen.
Yeah, inshallah, we'll do it. No problem.
Terrific. Thank you, sir.
Thank you.
Thank you very, very much.
Thank you.
Thank you.
Thank you.